Hi, I'm Isru from WSO2 Healthcare team, and I have Samira with me today. So today we are diving into CMS 0057 Final Rule and why it has become such a big focus in healthcare. If you are a payer or a provider, and even if you are a health tech company, this rule brings big changes to how you handle patient data, prior authorization, and interoperability. So, Samir, what is exactly CMS 0057 Final Rule?
Yeah, so well, in plain words, CMS 0057F is basically articulated by the Centers for Medicaid and Medicare and Medicaid Services entity. So it's for interoperability and prior authorization final rule. It's basically a landmark regulation which aims to break the data silos that are kept by providers and payers and make the data seamlessly accessed by mainly by the patients. So key focus areas are make access to the patient their data in basically the claims encounter and any clinical data to the patients and also make the prior authorization process hassle free by making the electronic making the prior authorization workflow can be done by electronically. The ultimate goal is here is a twofold. So mainly it's benefiting the patients to access their data seamlessly and making the prior authorization workflow hassle free for the providers and also ultimately benefiting the patients.
So, let's discuss about the impact this rule makes, maybe for patients and providers.
Yeah, so mainly for patients, so they will get seamless access to their health data that is kept by payers. So basically, CMS mandates to expose the patient's health records through standard FHIR APIs, and so the patients can seamlessly access these data through their favorite apps and instantly access to their health records. In the other side, for the providers, it will make their life easy by making the prior authorization process that is executed electronically. So current process is very uh, it's very burden to them. They have to go through manual processes and many back and forth communications, and it is a very time consuming process. So with this rule with the electronic prior authorization workflow, so this prior authorization process will be a real time process, and it's a big achievement for the providers as well as for the patients.
Yeah, and also for the health plans and the payers, they are being pushed by the CMS 0057 final rule to upgrade their FHIR APIs, to build stronger FHIR APIs, and to build these and to validate these patient identities properly and make them reliable. Further, this can be seen as an investment at the first, but in the long run, it will be less paperwork and less support costs, and they can build their relationship with their providers properly. And there are entities that needs to implement these rules specifically. They need to implement these FHIR-based APIs and workflows such as prior authorization, patient access API, and peer-to-peer data exchange for interoperability. So, who are these entities?
So in CMS rule, they are mainly targeting the payers in US. So there are several categories of payers in US. Basically, the qualified health plans who provide the employee-sponsored health plans. And also there are these Medicare organizations who are running the Medicare programs, and also the Medicaid entities, and also for the child insurance sector, they have this child health insurance plans, which they call as CHIPS. So all of these are the main payer categories in US. So they have to adhere to this mandate, and they have to expose their data for seamlessly for the health for the patient access scenario. And also then for basically not only for payers, but also as we discussed, this will impact for the providers and other health IT vendors in the sector.
So what exactly these payers need to implement? Shall we talk about the provisions in this rule?
Yeah, so mainly this mandate covers, so you have to, as a payer organization, you have to implement several key application programming interfaces, APIs. So there are mainly 4 APIs that the payer organization need to focus on. So I'll talk about the patient access API first. So the patient access API is there are elongated requirements from the previous regulation they had, the CMS 0057-F. It's mainly was there for this the patient access API mandate, but there's a elongation of those requirements with this new mandate. So you have to expose the additional clinical data through the patient access API, as well as you have to expose the prior authorization related data as well. So after mandating this, so that patient will get seamless access, real-time access to the health record that is maintained by the payer through any third-party apps that is integrated with the payer. So that's the advantage that the patient will get there. And also then it comes to the provider access API. So this is a new requirement that the providers will get access to the patient's health record that is maintained by the payers, so that the clinicians can instantly get access to the patient's up-to-date health record. So it will be very beneficial when providing treatments to the patients. So yeah, those are the main like the for those 2 key provisions. Those are the APIs that the payer has to implement. Do you want to talk about the peer-to-peer exchange API?
Yeah. The peer-to-peer exchange API is all about when you switch your insurance plans, and your data should follow you smoothly. As an example, if you change your job and you need to change your insurance plans as well, so the new payer has to request the data from the old payer. So this process is about the peer-to-peer data exchange, and this data will be taken through the bulk data export, which means that you get all the data in one go, and you don't even have to go by patient. All the data you will get in one go. And the next one is the prior authorization API. It is all about getting the approval for your medication order from your payer electronically. So we have a timeline to get all this done. One is January 2026 and the other one is January 2027. Shall we discuss about that a bit?
Yeah, so in January 2026, CMS expects certain reporting requirements from the payers. So this is mainly about the patient access API. So from the previous mandate, the CMS 9115F, payers has implemented the patient access API up to some extent, but for this 2026 newer deadline, they have to report some API matrix and prior authorization related matrix that they collect to CMS. So this will be done by annually. So that's about the nearest deadline. So the implementation wise, the key deadline of this mandate is coming on 2027 January. So in that deadline, payers has to implement the prior authorization workflow that is executed electronically, and also the patient access API and the provide access API. You have the payers have to expand the data that is exposed by those APIs. Basically, the clinical data. There are these US core data profiles. So the data that are covered from those US core profiles should be implemented by January 2027. So those are the main key deadlines.
So we know CMS 9115F has already been in the play. So it is required to implement patient access and provider directory, and it is also required to share patients' claim data and encounter data. But what is this big update in the CMS 0057F? What is a big change here?
Yeah, so CMS 9115 laid the base groundwork. So it's the first mandate that has came to make available the patient's health data to the third party apps, so that the patients can access their health record up to some extent. But in the CMS 0057F, so it's been extended up to the almost all the health record data that is available for the patient. Mainly, so there are extension on the clinical data, and also the prior authorization data that is kept by the health plans. And also in CMS 9115F, there was no focus on the prior authorization automation workflows. But here, a key focus area is to automating the prior authorization using the workflow suggested in the mandate. So those are the main key changes. So that is being done in this new mandate, and also they additionally focus on how the data that is existing on a payer and how it's been exchanged when the patient is changing the health plans, so that this peer-to-peer data exchange also a key area that is thought through this mandate.
Prior authorization has been a significant pain for providers and patients for a long time. The process is slow, it is manual. So let's discuss about some challenges that providers face.
Yeah, mainly. So the main pain point that the providers will incur is the lack of real-time communication when it comes to getting submitting the prior authorization requests. They are currently using methods like using faxes or just shooting mails or giving calls. So those are very manual way of submitting the prior authorization requests, and due to that, there are significant delays on processing those requests, and there's back and forth communication as well, and also there's this administrative overhead as well. So you have to keep someone who is in the loop, always checking what has happened to those the requests that has been submitted. So and also they face the disadvantage of these high rejection rates. So after these manual and long time processes, so if a request gets rejected, and then due to lack of documentation or lack of communication, it's very disadvantageous to the providers, and also mainly to the patients who need critical care. So those are the main disadvantages that that is faced by providers as well as patients in today's prior authorization workflows.
And when it comes to the payer side, there is a huge pain point too, right? Because payers receive a huge amount of request, and the process is manual, and it sometimes take days and even weeks. So all patients have to do is the patient are left off waiting. So sometimes their systems are also outdated. Then the delay comes at the patient side.
Yeah, so there's this administrative costs as well for the both sides. So they have to keep their teams checking for these prior authorization requests, and also going through all the documentations and the history of the patient's health record manually. So that's why this mandate is very crucial, because it will provide the competitive advantage for everyone who is adhering to implement the mandate requirements.
So what are the biggest blockers to fixing them?
Yeah, mainly, so there's like huge technical barriers. Today, the prioritization process uses many manual workflow. They are using old methodologies. Many of the payers using like fax to send the related documents. So they have these legacy systems and these legacy workflows in place. So main blocker is to transform the current workflows into modern the technology. And as well as the adoption of the slow adoption of these standardization that is happening through the healthcare industry. So this is mainly gathered around the FHIR standard. So there's a fair amount of resistance as well to change these workflows and then get their systems up to the interoperability standards in fast. And so yeah, but the point is, even though the initial investment that the pay organization or whichever the stakeholder has to bear, it's worth, because so the ultimately this will benefit both payers, providers, and the patients. All the stakeholders in healthcare industry will get benefit from adopting these workflows that is suggested by the mandate.
So we know WSO2 plays a key role supporting healthcare organizations to meet CMS-0057 mandate. Using the Accelerator for healthcare, let's see how this transformation is done.
Yeah, mainly the WSO2 Accelerator for healthcare provides like solid foundation to implement these key provisions, mainly patient access, provider access, prior authorization, and also the peer-to-peer data exchange. So WSO2 Accelerator for healthcare is being used to develop reference implementations for each of these key provisions, so that whoever using WSO2 Accelerate for Healthcare can use these reference implementations, and they just need to implement whichever the business logic to integrate with their system, and the other necessary running components are pre-built into these reference implementations. So in that way, the payers can use the WSO2 Accelerator for Healthcare to complete their compliance requirements and go to plan their go to market in very short time, and also they can minimize their compliance risks that's against the CMS requirements.
So, shall we give an example of how it actually works?
Yeah. So, for an example, let's say a pay organization has to implement the prior authorization workflow as the mandate suggests. So, there we provide a reference implementation to implement the prior authorization workflow. So, it consists of the necessary 5 APIs that are there and that is needed for the prior authorization automation, and also there's this clinical decision service that you need to expose in order to automate the prior authorization workflows. So that's also bundled into the reference implementation. So all the payer needs to do is do the system integrations with the existing systems, like their rule engines, the external servers, so that we have all the pre-built integrations within the reference implementation, and also we have the source connectivity support for any of the standard health data systems like EMR connectors, database connectors, HS7 connectors. So you can use to integrate with our existing systems, and also we provide powerful data transformation through our tools. So we have the visual data mapping capability, as well as we have AI copilot that can be used to map your data by just giving prompts, and also we have flexible deployment options. So each of these reference implementations you can just deploy anywhere, like in your VMs. If you have cloud native environments or containerized environments that is using Kubernetes platform, we have the support to get the deployable artifacts for them, and also we are providing AI native iPaaS as well. So if you want to get these reference implementations deployed into iPaaS, it's also supported. So yeah, so the WSO2 Accelerator for Healthcare plays like a major role that is giving away the hassle that the developers that has to go, and with these pre-built integrations and support to seamless data transformation and deployment options.
That is not the only thing that WSO2 offers. WSO2 goes beyond the CMS compliance and offers a whole set of capabilities that healthcare organizations can get the benefit in the long run. So would you like to discuss about that, Samir?
So WSO2 offers a powerful API management platform that is recognized by the key analyst reports that are there as a strong leader in the API management space. And also the organizations who adhere to technology, they will get our API management platform, and they can manage their APIs. They can develop the APIs, manage the life cycle, and also they get strong API analytics capabilities, and also we support microservices and cloud native deployment through all of our platform. So today in today's world, being cloud native will give you upper hand, So we are leveraged with the latest microservices and cloud native capabilities throughout our platform. And also we are a strong identity platform. We have a product that is identified in the identity consumer identity space as a strong leader. So these capabilities are provided through the WSO2 technology on top of whichever the advantages that you get in order to implement the get the compliance by implementing your compliance implementations using WSO2 Accelerator for healthcare.
So, Samira, any advice for the payers who are just getting started?
Yeah, definitely. So one key thing is, as a payer, you don't have to wait until the deadline is nearing by, but you can plan. You can plan now and look into your current system integrations, and your current workflows, and plan how it can be integrated with the suggested workflows in the mandate, and also choose the right technologies to comply fast, and so your investment would not go in vain, and also be sure to address the critical areas like how you manage the patient identities, patient consent. So those are the future areas after this mandate you have to mainly focus on. So choose wisely your technologies and your workflows, and think beyond this mandate, and plan early to get the compliance related implementation early.
CMS 0057 Final Rule is not only about checking the box of compliance, it's an opportunity to modernize your healthcare workflows in your organizations. We at WSO2 help you make that process smoother using our pre-built FHIR APIs, data transformations. It's all about saving time and money. Ultimately, it's improving the patient outcomes. So stay tuned for our next upcoming videos about implementation of the key provisions.